welcome to the 8th session of What is Not Taught in Medical School series, our online lecture program of OrthoTV. I am Dr. Dhiren Ganjwala, a practicing pediatric orthopedic surgeon from Ahmedabad, along with my colleague, Dr. Himanshu Desai, who is a consultant psychiatrist at Ahmedabad. We both will host the today's session. First of all, let me tell you something about this webinar series. What is not taught in medical school complements medical school curriculum. In practice and in life, we need many skills. However, not all of them are taught during 4.5 years of medical training. So in this series, we try to cover areas that are not included in medical school curriculum. And if you like the concept, please stay till the end. I am going to share one important piece of information before we close, before I pass a vote of thanks. Coming to the today's topic, and the topic is on presentation skill. And why is this important? Imagine that you are invited to speak for 5 minutes at your city meeting or at the state level meeting, and there are 50 people in the audience. If you don't use those 5 minutes well, it means you have not wasted your 5 minutes. But if you multiply this 5 by 50, you have wasted 250 minutes. So learning how to present effectively is an important professional skill and a skill which most medical person should learn. So today we are going to learn, or we going to learn this from a very eminent expert, very seasoned professional speaker, Dr. Vihang Vahia. Dr. Himanshu will give an introduction. But before that, I just would like to say, if you have any question, please send your question on WhatsApp on my WhatsApp number. That's 97129 25600. I repeat, 97129 25600. So with that, now I hand over to Dr. Himanshu Desai to introduce today's speaker, Dr. Vihang Vahia. Over to you, sir. Thank you.
Thank you, sir. Good evening, friends. It's my privilege to introduce Dr. Vihang Vahia. He is very much known in the circuit of all the psychiatrists of all over India. And he is very much known in Mumbai and Maharashtra circuit. Dr. Vahia, sir, is International Distinguished Fellow of American Psychiatric Association, is Professor Emeritus of Psychiatry, Dr. R.N. Cooper Municipal General Hospital and HPT Medical College, Mumbai. He was a founder of Psychiatry Department of this college. He is former Professor of Psychiatry at Cooper Hospital and State GS Medical College, Mumbai. He is Consultant Psychiatrist at Beach Candy Hospital and Lilavati Hospital, Mumbai. There's a long list is there, but I'll cut short and let's have fun with Dr. Vihang Vahia. I've heard him many times, and he's gem of a speaker, and we have learned a lot from him. I hope today through OrthoTV we all will learn many things from Dr. Vihang Vahia, sir. Over to you, Dr. Vahia, sir.
Grateful. Thank you very much, Himanshu bhai and Dhiren bhai. It's indeed a privilege to be present here and share my experience on presentation skills. There's a small history here. About 15 years ago, there was a conference in Delhi. And people, after the inauguration, there was a break before the president's address. And when the president started giving his presidential address, there were about 15 people in the hall. Everybody else was waiting for pakoda and chai. And suddenly we found a red, so we were 5 of us, Mohan Agash and Vidadhar, we were sitting in the last row and cracking jokes, when suddenly there was a red light, laser light on my tie. And Dr. Mohan Agash said that probably the president was going to kill me with a laser beam. We also realized that time that all on a sudden, the president seemed to have gone into a bad cough. We later found out that he had cracked a joke and nobody heard it. That gave us this idea. So we started making a presentation on how not to make a presentation. But that's a long thing. And since that's not what you want to know, all those little errors, let's kind of change. May I now add may I share my screen, sir?
Yeah, please, sir.
Okay. So there it is. And we are going to talk on how to prepare a presentation. All right. I'm Vihang Vahia. I'm an old guy, and I've been kind of going through this for a while. How to prepare a presentation? Because my perception, which is shared by most people, is that now what's happening? I have no conflict of interest in this presentation. This is my invitation. All the data that I'm going to present is from open sources or from my own previous presentation. So there is no plagiarism in my presentation. All of us know that after the first 5 years of practice, all consultants, surgeons, physicians, pediatricians, in fact, even paramedical staff, gather some experience that they want to share. Any professional can become an active presenter. But remember, when you make a presentation, the depth of your knowledge is not enough. What is important is how you are able to present it to the people who are listening to you. Because that's why I have learned over the years that investing time and efforts, making positive efforts by rehearsing and re-rehearsing your presentation to make it sharp, crisp, and meaningful is always rewarded. Why does a person want to make a presentation? Either because there's a topic of research, original research, or the speaker has kind of gone and got himself or herself trained into some specialized aspect of the medical practice, or the speaker is passionately committed to discuss a topic to disseminate either information or knowledge. What's the difference? Information is data. We can get them from ChatGPT or Google. That is just data. A good presenter will present knowledge. It is a data which is interpreted, simplified, and made applicable to the audience's practice or lifestyle. So, information, everybody gets it. In fact, we are an information overload in today's time. Knowledge requires effort to convert the information into some kind of a meaningful thoughts presented to the audience. Why do those? There's another set of presenters. They do it to either present to promote a concept. Sometimes the institutions want the parties, the members of the staff to make presentation to different audiences. And unfortunately, in the recent past, what I have seen is that our professional colleagues who are trying to contest for a post in the society, Indian society of whatever, and they want people to kind of, praise them. So to promote themselves and to give popularity amongst people who otherwise would not vote for them is another set of speakers. And to my mind, this is not the best of the presentations. Then there are, organizers or the colleagues who have expressed interest in the topic that is being presented. Like this presentation, for example, when Himanshu bhai and Dhiren bhai said, talk about presentation skills, that's not something original. I have kind of gathered data, converted into a meaningful presentation, and I'm talking about it today because, well, my colleagues, my friends, people who matter to me said, why don't we share it? Of course, why not? But the most irritating is this masala mix. Every once in a while, you'll have a person calling you up and saying, sir or madam, we have a conference. It is 2 days from now or 5 days from now, and there is no speaker. So because there is no speaker, it might as well be you to speak. Not because you are anyway precious, not because you are important, but because you are available. These invitations really distress me, and I usually tend to reject this at my level. one of the hospitals where I worked said, we want you to talk to an industrial house who send their staff members to our hospital, and they want to know about stress. So I said, why do you want me to speak? There are 5 other psychiatrists attached to the hospital. They said, no, they are all busy, so you might as well speak. So I said, okay, am I going to be kind of compensated for making this presentation? They said, no, we want to do it free. I said, you want to do it free for your sake. Why should I spend my time? If you still want it, I'll do it when I am free time. I'm not going to sort of, in my OPD hours, I will not close my OPD and make a presentation to them. So they said, okay, Dr. Vahia, you come and I will give you 2,000 rupees for the talk. I said, for that amount, I'll ask my driver to make a presentation. We have got to keep our respect and dignity. It may not be in terms of money, but it should definitely be in terms of dignity of your professionalism. Then we have to know what is the audience. There are types and types of audience. The best audience is the curious audience that wants to acquire new knowledge. We have read so much about this, doctor, but please make us understand what we have read. This is the best audience. It might be either in reference to some original research or review of literature or a meta-analysis. Sometimes there are contradictory meta-analysis and a speaker to sort things out for the audience. Then there is a group of people who attend a presentation to seek new information or to learn new skills. Skills training workshops are becoming more popular these days, especially in orthopedics. There's a whole lot of skills training workshops and conferences. So who would be the audience here? It could be general non-medical people, stress management, diet control, metabolic disorder control, importance of exercise, importance of physiotherapy for orthopedic surgeons. Or there'll be specific non-medical audience like students. As psychiatrists, we get called upon to talk on examination stress. Administrators call us to improve their own work efficiency. This is a very different non-medical audience. We do not present medical data, but we present knowledge that we have gained from our own experiences. Then the caregivers. I remember an orthopedic surgeon talking to a bunch of caregivers of joint replacement surgery. And he said, you must have regular physiotherapy, because when I replaced your joint, for a 60-year-old man, he's now got a joint which is 25-year-old, but the muscles are still 60 years old. So it's like a 60-year-old man being married to a 25-year-old lady. He has to come down to the spirit of the 25-year-old. Audience grasped it very well. And the physiotherapy in that area and his patient population improved significantly. Then there is medical audience. They may be primary care physicians, there are nursing and paramedic branches, or there could be Ayush practitioners. Medical audience can be somewhat tricky. Every city has its own peculiarity of medical audience. And there are times when you go to speak and somebody will ask you a question from the audience, not because they want to know something from the speaker, but they want to tell the speaker that we know better than you. They use this opportunity to promote themselves, saying, speaker ko to tumne bulaya, magar I am the best. I should have been talking to you. And remember, when we talk to any audience, it should be new information. I am reminded of George Bernard Shaw. He said, I often quote myself. It adds spice to my conversation. This is not medical, or this is not a knowledge presentation. That's a lay presentation. And when you talk of knowledge or skills, there is another English idiom which says, those who can do. Those who are good at surgery, perform surgery. Those who are good at clinical practice, practice the clinical medicine. But those who can't, teach. I'm teaching. Probably that speaks for itself. And then there is a dictum while preparing a presentation. How much does the speaker know is important. But what is more important is how much is conveyed. We don't want to make a presentation to impress the audience. when you present a task, you want the audience to the audience should not feel कि ये तो इतना बड़ा complex है कि मैं तो उससे दूर ही रहूंगा. No, not that. We want to tell the audience that nothing is complex in this world. A good speaker simplifies a complex topic, and a bad speaker complicates a simple topic. So make sure that you convey your information in a proper knowledge, not just raw data which the audience has to sort out. Avoid a miscommunication. I had one of my teacher bring his son for his second year's examination 2 weeks before the exam. And this child was very panicky, anxious. We had a long marathon session from 8 in the evening till 10 at night. And at 10 o'clock in the night, as he was leaving, I told the boy, I said, look, my son, you are now looking good. You are looking great. You are a good student and you'll do well. Please don't get anxious. God bless you. He went out and told the father, Dr. Vahia says, only God can help me. So people kind of understand what they want to understand. They don't necessarily understand what you tell them. So during the conversation or during the presentation, try to put questions to the audience which they can reflect. It can't happen on a Zoom talk, but it can happen when you are in an in-person talk. And we have to be able to engage the audience. For the 20 minutes, 25 minutes, whatever, the audience should be interested in you and not in the WhatsApp jokes that keep coming. Another dictum is there is death by PowerPoint. What you say is significant. What makes it, how you present makes it interesting. But how much you put across is crucial. People have not read what you have read. They are naive to the topic you are presenting. And make it simple and easy for them to follow. There are lots of data on how to make a presentation. I am picking up the one from the Boston University. There are some rules for making a presentation. Remember the golden rule. Attention span of the audience is limited. The speed at which a speaker should speak is 80 to 100 words a minute. The speed at which the audience can think, unless intoxicated or drowsy, is about 600 words a minute. So there's a discrepancy between the verbal input, the auditory input, and the thinking capacity. And if you do not engage the audience, there's a bow effect. People lose out the connection with what you're talking and they get lost in their own thoughts. Application of this, do not cram too much of information in the slide or in the whole talk. Just give enough for the audience to be able to understand and feel interested in studying more. And avoid details. If you give too many details, all of us have gone through this. We would say, oh, 3 साल पहले एक बंबई से डॉक्टर आया था, नाम तो मैं भूल गया, वो बहुत अच्छा बोला, मगर क्या बोला मेरे को याद नहीं. That's no fun. People should say that एक आया था, वो स्पीकर का नाम याद नहीं, मगर उसने ये 2 बात बताई ना, वो मेरे दिमाग में बैठ गई है. That is important. And when you mention details of whatever you are doing, please mention the details only if that is going to be a carry home message. What is the point in presenting a slide like this? When we present a slide like that, or when a speaker presents a slide like this, the speaker himself or herself gets lost. It's almost like the speaker asking the audience, somebody help me, why am I making this presentation? Why did my registrar or my assistant even prepare this slide? I can't even read what is said. And a slide like this. So there are some hints about the font size, the rows and the lines. For the title, use serif fonts like the American typewriter, Times Roman, Emmer type. These are the serif fonts. For subtitles, use preferably the same, but you might change the font. But the subtitle should be shorter, smaller, at least by 2 points compared to the title slide. For text, use sans serif fonts of the size 22, 24 or 28. These are the Arial, Comic Sans, Agatha and Calibri. And for references, use the sans serif fonts in 14 and 16. So what is this business of serif? Look at this. Look at the lines in the T here and the T here, or the S here and the S here, or the F here. I don't have a capital F here, but look at this F. Z here and the Z here. These little lines at the end of each letter, that is called serif. And the font that doesn't have a serif is called sans serif font. Sans serif fonts, you can put in more data in one line. They require less space between two letters. Serif fonts, like the title here, is good for the title, but the rest of it should be in sans serif fonts. And when number of words in one line should be about 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. There are 13 words plus the number. So depending upon the size of the font, you don't have more than 12 slides. That looks cramped up. And the number of rows should also, excluding the title and the subtitle, should be about 10, depending upon, again, the font size. So let's see here. There are definitely more number of rows than 10, and the slide definitely looks crammed up. Then organizing the talk. Pick up a theme. Don't pick it up from the textbook. Think of something catchy. And catchy but not very prosaic. It should be meaningful to the audience. The audience should get a rough idea of what you are going to talk about, and it should motivate audience to attend and pay attention. So, we have this serotonin antidepressant, serotonin reuptake inhibitors, and dopamine reuptake inhibitor and antidepressants. So we say Sari and Nari. Serotonin antidepressant and noradrenergic antidepressant drug. Sari, Nari and depression. So people wanted to know कि अभी तुम्हारे talk में सारी कैसे आ गया. So you use a kind of something catchy that should make the audience want to hear what you are saying, and not one of those run-of-the-mill titles. Give an introduction which is not too technical, but it should be strategic. It should be to the point. So you could include why did you select the topic, or why is this topic being presented, and what is its relevance to the audience. Am I telling you this because I know it, or am I telling you because you are going to benefit from hearing this? Then mention the past publications, but don't put details. Just make a reference to it, especially if you are presenting your own reference. There should be just one message per slide. And in conclusions, as far as possible, just one clear message. Very often, it's difficult to restrict to just one. So you present not more than 3 carry-home message in a 20-minute talk. And essentially, the conclusion should be the last slide. You don't begin with a concluding slide. This is tricky. Making a 20-minute presentation requires about 150 hours. Making a 40-minute presentation can be done in 20 minutes because you have to be sharp and decide what you want. The 20-minute presentation, if you're making it for the first time, you should be prepared for spending 150 minutes on reading it up, deciding what you want to say, prioritizing the knowledge that you want to present, and the time. How do you organize the talk? Now, here I've put sans serif font to make you see the difference between serif and sans serif. Give periodic talk lines, talk outlines. There should be at least one talk outline, usually after the introduction, and this is recommended. What is talk outline? We'll come to it in a little while. Then, when you have multiple slides, if it's a continuation of the topic, when you shift from one slide to the other, audience will not be able to retain the connectivity. So if there is something that you want the people to connect from the previous slide, repeat it in the next slide. If not in the text, at least verbally repeat it. So they know, not just a color coding, but whatever the message that you want to kind of collaborate with the next slide. And restate the information if it is important enough. If you want the people to remember what you have said, restate the information. The ideal speak time is 80 to 100 words a minute. People who speak faster, they lose out the audience. Gujaratis and Malayalis speak very fast. So we've got to be slow. 80 to 100 words per minute. And make sure that preferably a spouse hears and understands what you are saying. And it might be even more helpful if the spouse is not from the same specialty. Your presentation has to be sequential. You can't jump from topic to topic. Not more than 3 carry home messages. I have been saying this again and again because people can't remember what is being told. Present an overview first and then give details only if the audience is interested. During your presentation, if more than 50% of the audience starts looking at their mobile phone or starts laughing looking at the mobile phone because of some joke that they've read on WhatsApp, or somebody starts snoring or falling on the neighbor's shoulders, that's an indication to say that the audience is not engaged in the talk. What is a talk outline? I'll give an example. Say, how to prepare a presentation. I'm going to prepare this effective in 10 subtitles in the next 20 minutes. So I'm going to spend about 1 minute. So let's begin with topic of presentation and then present a slide or two on that. Then say, let's go to the next point. Relevance to the theme of the meeting. Again, 1 slide or maybe 2 slides. Then, why did I agree? Or why is this topic important? Motivation for accepting the invite. Have I accepted the invite because my future wife is sitting in the audience? Or am I making this presentation because my ex is sitting in the audience and I want to tell that person, oh. You have to be very sure of your reason for accepting the invite. Or make sure or try to coordinate your talk with other topics at that meeting, that my presentation is between this topic and that topic because this is what it is supposed to convey. And there should be just 1 slide per point. For building tools is MS PowerPoint or Keynote. I like Keynote actually, though these presentations on PowerPoint. And professionalism is important. You cannot go to a conference looking as though you just got out of the bed. Dress up well. If you are not sure of how to dress or how much to dress, overdress, but don't underdress. There are some speakers who come in a casual half-sleeve shirt with parrots and mangoes on their t-shirt. Some of them are able to carry themselves well, but not all. If you want to wear those colored jinchak clothes when you go to make a presentation, if you're sure of being able to carry yourself well, that's fine. Otherwise, people will look at you and not your presentation. For the ladies, when you put the collar mic, for the men, it's easy, they put it on the shirt or the jacket. When the lady is wearing a sari and puts a collar mic, the collar mic should be above or in front of every other fold of the sari. Otherwise, during her talk, the sari will keep rubbing against the mic. So you have to be sure and completely professional and make sure that nothing goes between, nothing kind of blocks your talk and the mic. The mic should be about 6 inches from the mouth. And that's the way the mics are able to pick up what we are saying. For formulas, use any of the program that you are used to. Humor helps if you are comfortable with it. And if you have decided that in a particular presentation you are going to crack a joke, rehearse it. Be very sure of which spot you are going to use joke at what point in time. When you are making the presentation, it should appear as though it spontaneously struck you. Fact of the matter is, you would have rehearsed it 20 times before you speak before the audience as though it's a spontaneous joke. There has to be a rehearsed spontaneity in cracking a joke during a presentation. I repeat, you have to rehearse the joke, the spot, the way you're going to speak it, the kind of gestures you're going to make with the joke. But when you present it, it should appear to the audience as though the spur of the moment the joke has come to your mind. It should not look like a pre-text joke, but it should come up as spontaneous after a lot of rehearsed spontaneity. if you are not comfortable with the jokes, don't crack. It's not essential. But don't improvise a joke suddenly, spontaneously at the last minute. It can fall flat. And rehearse the talk. The more you rehearse the talk, it's better. Dhiren Bhai knows that over the last 10 days, I have kind of come down to these about 20 slides from a stock of 50 slides. And then I presented it to my younger colleagues and to my spouse, and I read it to myself at least 7 times before I've come before you today. The rehearsal should be loud. Your voice should be heard by others. You got to throw the voice to the audience and not at the mic. And look at the audience. Don't just read the notes, no matter how good your handwriting may be. At least 5 rehearsals before a person who hates you, somebody who's out to find faults in you. That works better than somebody who's going to apple polish you. The more the people criticize your talk, the better. And every criticism should be taken seriously and make the necessary modifications. Another thing that happens very often is that the speaker loses the mic, he turns around, looks at the screen, and starts reading the slide. So when the speaker does that, the mic does not catch the voice, so audience can't hear. Besides, people are not interested in seeing the back of the speaker. The front is always a better presentation. And then the speaker also is lost about what happens to the audience. It's quite likely that by the time the speaker kind of rotates himself, looks at the audience, half of the audience would have got up and gone away. Please be enthusiastic about your presentation. And a good presentation should be a Nobel presentation. Nobel presentation. There is no point in the chairman ringing bell, ting, 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 tong, 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 and you go on speaking. No, that's not good. You must aim to end your presentation at least 5 seconds before the chairman is likely to ring the bell. Act your talk. Be animated. Don't stand there like a robo, like a statue. And you should look surprised when you're presenting something that, when I got this result, lo and behold, I was surprised that we found this. And it is so important because it changes the line of treatment or whatever. And when you do that, let people think. Let them absorb your importance of what you have said. The audience should feel, okay, wow, that's a great point. If the speaker was impressed, there is something I need to understand better. Anytime there's a question, listen to the question very carefully. It is so silly that a speaker who's kind of an egoist may not listen to tends to kind of undermine the intelligence of the audience. So what the audience asks and what the speaker replies may not be related at all. That should never happen. If somebody asks you a question and if you're not able to understand the question, ask the person to repeat it. And after the person repeats, if you still don't understand the question, ask the chairman to repeat the question for you to be able to answer it appropriately. Never ever underestimate the intelligence of your audience. The fact that they have come to attend your talk means that's an intelligent lot. A person who is not intelligent would not come to hear your talk. So the fact that the person is sitting in the audience means the person is so intelligent that he wants to hear your talk. Keep this in mind and be respectful of the audience. And one size does not fit all. There are times, it has happened to me, in 1 week's time, I would have made 5 presentations or 7 presentations in 5 cities. Every presentation has to be rehearsed. If there's a presentation in the morning and one in the late evening, I would spend the afternoon rehearsing, making some changes, putting in some information that came in from the previous presentation to modify my talk to make it sharper. Every presentation is unique. Don't ever say, oh, I have this on my slide, I can do it. I'm such a great speaker, I can speak extempore. That's a terrible speaker. Never ever be an extempore speaker, especially when you're making serial presentations. Because there'll be somebody in the audience who's compelled to audience, like a pharma company. If they're hearing you 5 times, they should get something new in each of the 5 presentations. because every meeting is unique. It's a unique set of audience, unique set of preference, unique set of target for the audience to attend your meeting. And never ever used these mass produced slides. I learned this fortunately without getting embarrassed. An international drug company was holding a seminar on a new drug that they introduced in India. They would have probably got 4 speakers and one speaker didn't turn up or was not going to accept or something. So they came to me a week before the meeting and said, "Sir, we need you to come to Delhi," or it was Hyderabad, "and we need you to talk on this particular aspect of the drug. And sir, don't worry, we'll have the slides." I refused to accept the slides. I said, "I have the material, I know your drug, I've studied, I'll prepare my own slides." There was yes, no, nothing. If I'm going to speak, I'll have my slides. When we went to the session, it was a British Royal College of Psychiatry, Indian Psychiatric Society together. And the previous 3 speakers, 2 of them international speakers, and the third Indian speaker had the same set of slides. Same set of slides, 3 speakers spoke whatever they had to. It would have felt so stupid for me to be the 4th speaker repeating the same set of slides. But because I had a different set of slides, it attracted attention. People who wanted to walk away came back and sat down and listened. Never ever accept mass produced slides. There will be people who tell me, "Dr. Vahia, you had made this presentation. Will you please send me your slides?" Never do that. Slides are only bullet points. What is important is the narrative between the bullet points. So make sure your narrative is sharp, precise, and the bullets are only to help the audience remain focused on what you are trying to talk. And please understand that if you're going to a new city, you want the people from that city to feel important about their city. So I usually use the picture or some iconic spot of that city on my introductory slide. Something special to make the people feel that you are treating this city as something special. And the audience, by virtue of being a resident of the city, has to feel special and not that ye to Bombay se hai, apne aap ko kya samajhta hai, these things I am no good. No. Every city is important. Even a small town is important. Even when I go and speak to the peripheral centers in district meetings, even that is important. And whatever the special features of the city must come in your introduction side. Never ever compare the audience or the specifics of one city from other. Don't say that in Delhi the hall was very good, whereas in Agra the hall is not that good. Never ever say that. Every city is important and you don't want to insult anyone. So ladies and gentlemen, I have only one carry home message. My message is that if you have to say something that you believe is worth sharing, then it's important that whatever you say it well. Because what you say is important, no doubt. But presenting it well makes it meaningful. Ladies and gentlemen, I think I've overshot my time, or I would be about to overshoot my time. So before there is a bell, thank you for so patiently listening, or at least not being asked to shut up halfway. Thank you very much.
Thank you, sir. This was absolutely Nobel presentation. Good. While you were telling us the difference between information and knowledge, I had one analogy in my mind. Information is something like the raw food, and the knowledge is when you cook it, you make it more palatable. So that's the understanding I have about information and knowledge.
Very good metaphor, sir. Very good metaphor.
Yeah, so that is very important. And yes, people are looking for your knowledge, and information is available everywhere. So that's one thing. The second thing, I'm sure that now you must have seen in last 1 year or so, a lot of presenters, they come up with AI generated presentations. So what is your take on that?
I wish I could comment on it, sir. See,
No, we
we
want
all
to.
use Google. We collect data from AI. AI gives data. AI doesn't give knowledge. AI, to continue your metaphor, AI gives you the recipe, but it doesn't cook it for you. So the metaphor that I often use is that even if you get a couple of crores to buy a car, if you don't drive it well, it will never reach your destination. But if you are a good driver, you can even take a rickety car to its destination. A good speaker can simplify any complex topic, and a bad speaker will complicate simplest of the topic. If you get a new Mercedes, what, 25 lakhs now? No, 55 lakhs. Get it out of the showroom, and if you don't drive it well, you're going to, take it up the tree. It's not the car's fault. It's the driver's fault. If you can't make your audience understand what you're trying to say, it's a speaker's fault, not a topic's fault.
Okay.
Sir.
The second point is about when we present, it's a package, and that package include three things. The first is the content. What is a gift? The second is the slides. That's the how you packet it or the gift wrapped it. And the third thing is the delivery. So how you give your gift to someone. So these are the three things. So how you ensure that all the three are proper: the gift, the package, and the delivery.
Very interesting that you should ask, sir. With your seniority, I hope you're not pulling my leg. But,
Absolutely no, sir.
sir, the content is important. Now, whenever you're presenting any topic, you can't present everything about that topic in the given time, even if you're given 1 hour presentation, unless it's a seminar which goes on for 3 hours. So you got to select which part of the topic you want to make a presentation today. Sometimes there can be a serial presentation, as in a teaching session, that we do this now, this next time. Then the colors of the slide. Either it should be a white background with dark letter, black, dark blue, or dark red. Now, here comes the trick of the projector. There are some projectors that fudge the colors, especially the red color. So whenever you go out and if there is going to be a projector projecting your slide, make sure that you run through the slide and that projector a couple of times. If you have used special fonts, then store them as PPTX and not just PPT, because what happens otherwise, if the computer, many conferences they ask you to put it on a pen drive and give it to them through a central computer, and if that doesn't have your fonts, it messes up the kind of composition of the slide. Though many good conferences nowadays let the speaker use their own laptops. Over there, if you are using a MacBook, connect your connectors, because the computer, the projector plug doesn't fit into a MacBook. You need to carry your special adapters and make sure that your adapter works on that particular projector. It's important to do that. And then, as of course, there's mirror imaging and all. So it's important to have done that. Third, the delivery. Now, that's kind of, you've got to keep the audience awake and engage them. So sometimes it's important to prepare this beforehand. There are some speakers who would have 50 slides in a 20-minute presentation. So they would project a slide and say, no, 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 let's skip this. No, 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 let's skip that. That should have been done before the speaker went onto the podium. Make sure you have at least 7 to 10 minutes between the previous speaker's half face through his speech and you going up. So cut down slides that you think can make the audience kind of get bored. Sometimes when I'm not sure, I have 2 or 3 versions of my presentations of different durations. And last minute, I would decide which is the one that I'm going to project for the day. Because what you know, the audience doesn't want to kind of they are not there to praise you. And you don't want to go and say, audience, look, I'm the greatest. That would happen if you're contesting an election for the society. I am the greatest, and you better vote for me. And if you don't wait for me, you don't deserve to be in the specialty. I hate that kind of presentations. That's one. Two, that's a different group. But if you're genuine, that you want to share knowledge, then you got to know how much can the person grasp. Simple thing, when you are kind of teaching something to a 4-year-old child and teaching the same thing to a 14-year-old child, you change your skills. You have to adapt to the audience. Keep looking at the audience. People like to be looked at. People hate a speaker who just keeps reading the notes. No matter how good your handwriting, look at the audience and look at everyone. I was once at this is no political coverage, but I was at Ambaji temple for my darshan. When Narendra Modi ji, when he was that time the Chief Minister of Gujarat, was visiting the temple. So we were all standing. The temple was closed for the and all of us, about 50 of us, each one of us swear and say that Modi ji looked at me. My brother-in-law, who was in the US, had the same experience with Mr. Clinton. He said he swears and says that Mr. Clinton looked at him and gave a smile, which is physically not possible. I mean, there is no way Modi ji would have looked at me and smiled. There was no, maybe my baldness might have hit him because of the bright light, but otherwise, there's no reason why he should be giving. But I swear and say that he looked at me and smiled. And my wife had the same thing to say, and my son had the same thing to say, and a couple of other people who were standing there had the same thing to say. Modi sahab ne hamari same joyu. That's a skill. We may not have it as sharp, but when you're talking from the podium, look at everyone. It's important. So these are the 3 things, sir. Content, not too much, not more than 3 points. Slides which are easy to read in a proper font. Some people put jinchak slides, multiple colors, and I mean that is okay for a film, not for a medical presentation. So either have white with colored letters or have dark blue with yellow and white letters. Sometimes green goes well with blue. And within that, if you want to have a brown bracket and yellow or white letters. But don't put these, very showy slides. It doesn't help. Don't put sounds, dishu, teshu, with every animation, a slide comes and no, that distracts the people. In fact, over the years, I've learned, try not to use too many fonts also. It distracts the people. So, Mohan Agashi told me this, that when you keep changing the font because your computer has many fonts and you like to show, don't do that. Don't go to show off your computer skills. Go to share your knowledge. That's important. Modesty has to reflect in your presentation. Sir.
Yeah.
Sir, what about, I mean, you very well said about humor. Then what about using shairi when we are talking to general population or not in a medical?
I don't use shairis because I'm not a shair and I would fumble. But I know some people who come up with shairis, as a kind of what sounds spontaneous would be a rehearsed shairi. Not something that Manmohan Singh used to recite a shairi while presenting budget and all. But it had to be a very well rehearsed shairi, not a sudden shairi. I haven't heard the current Prime Minister use shairis in his talks. Fair enough. So it depends upon your comfort. My friend Prakash Kothari, he always recites shairis. He's more of a shair, like I tell him, than a doctor. But that's a different story. I mean, it depends upon your level of comfort. And it has to be a rehearsed spontaneity.
And
then don't recite a Shairi because it sounds good. It should be relevant to what is being discussed. Yeah.
But for that, you need a huge stock of shairi with you so that you can find the right shairi for that particular
So
point
some
which
people
you.
have it. I mean, they just come up with this, and I don't have it, so I don't use it. Yeah.
What about humor? You said that you have to practice, you have to ensure that at this particular slide you want to bring humor. So, can you tell us more about that? Because that's not well described in the books or in other
So
YouTube
that depends
videos.
more on the temperament of the speaker and the audience. And nowadays, we have to be very careful of the gender of the audience. So, any humor you crack should not offend the gender and should not offend the gender preference of the audience. So, don't crack a joke on gender preference or on a particular gender. It should be very neutral. And there was a time when it was a fashion to talk on, oh, one Sardar said this, one Sardar. Don't do that. So you got to be very selective in the kind of humor that you use. It comes spontaneous, like somebody said, sir, ऐसा हो गया, चोरी हो गया, क्या करूं? अच्छा हुआ ना अभी चोरी हुआ तभी तुम गाड़ी में नहीं बैठे थे. Now that kind of a thing can come up, but it comes up when the speaker is relaxed, not tensed, and if you are not sure of how the audience would take it. One of the things I used to always say that what do people want today? They want shanti in their life. So only way to have permanent shanti in your life is to marry a person by that name. Now, this is a neutral joke to get. Till one day the chairman was a shanti sitting there, and then I didn't crack that joke. So you got to be, you got to be relaxed. Yeah.
How about using metaphor in the talk?
I often use it, but the metaphor has to be relevant, and the metaphor has to be brief, and again, it should not be culture specific. It should not insult somebody's sensitivity. So if you are not sure, it's better. With so many humorous cartoonists, stand-up comedians have got into problem because the audience felt offended. So you got to be a little cautious. We are in a phase where if you're not plumb certain, don't use it. Yeah.
Then another point is about the story. Like you narrated few incidents, so something like that. How do you use story in your presentation? I'm not talking of a storyline. I'm talking
Nah,
of the incidents.
sir, I'm just sharing my personal experience. This
Yeah,
was not a
exactly.
story. This was a personal experience that I was sharing. So then it depends upon the stock of whatever memories you have which are relevant to the presentation. You can do it. But don't borrow somebody else's story. That doesn't work. You know, it happens to me. Dr. Vahia, joke bolo na. You can't just say a joke bolo na. I said, WhatsApp pado na. That kind of a thing. So you got to be very, very sensitive. And when in doubt, remain conservative.
Uh, Another talk, sir. Sir, I've seen in many oration presentation. It is so worst presentation I've seen in my life. Then I don't know how to help those people who present that oration.
You can't. This somehow orations get given by the presidents. And for some reasons, there are presidents who feel that they are the God's given gift to human race. And then they want to say about how great they are. Nobody cares. Nobody cares. So the moment the speaker starts talking about, I did this, I did that, maine aisa kiya, man, that's not what you want to know. You want the oration to stick to the topic, a oration which has some reason to suspect or to kind of judge that the speaker has some skill about the topic of oration which is not common. Either it is something new, or it is something that is being adapted, or something that is modified, and the speaker is presenting. And a knowledgeable speaker is important, but a speaker with good communication skill is more important. And in orations, I agree with you, because then the speaker, orator, loses the pulse of the audience, doesn't realize that मैंने ओरेशन देना है, मतलब मैंने 45 मिनट्स बोलना है. क्यों बोलना है 45 मिनट्स? People can't retain attention for 45 minutes. 25 minutes is the maximum if the speaker is really, really good. Otherwise, people kind of, miss out. I used to often tell my younger colleagues in my younger days that when you attend an annual conference of the society, you must attend the general body meeting. Because general body meetings are usually held in comfortable halls. The AC is well looked after. And then you find a good place for yourself and go to sleep. When you wake up, there'll be some hot discussion going on. So you raise your arm. They'll say, yes, Dr. Vahia, what do you have to say? You have no idea what is being discussed. You don't know who has said what, but you just raise your finger and they say, yes, Dr. Vahia, I would say, as per which bylaw? And then go back to sleep. Then again, when you get up, there is some hot discussion going on. So you again raise your arm. They say, yeah, doctor, what do you have to say? Is there a precedence? And go back to sleep. You don't know what is being discussed. You don't know what the topic is. You don't even know why it is being discussed. But you make your presence felt and go back to sleep. That is one kind of participation in meeting. I had somebody very well known to me speaking on diabetes and the newer diabetic drugs. So she said, I'm going to this particular city, Dr. Vihang, and tell me something about what should I expect. And I told her, I said, when you're going to this city, this is what the audience will be like. When you go to that city, this is what the audience would be like. The group of 4 from Harvard, or 2 from Harvard and 2 from San Francisco and Columbia. And when they were here, I called them for dinner. My sister-in-law had told those speakers that Vihang has said that this is what we expect from the audience in this city. And all of them said that I was plumb to the point in predicting what the audience will be like. There are some places where the culture is curiosity to learn. There is some culture where there is curiosity to be there just to make presence felt and make it a social gathering. And there are some cities where the people attend the meeting not to understand or learn from you, but to show off themselves and want to make the speaker seem sort of inferior. So we've got to gauge the audience before we start talking. And with little experience, you would get to know what the audience is like. I went to Jaipur before the internet became so common. And there was this, Himanshu would know, the concept of fast off effect of newer antipsychotics, which produce less side effects. Now, an Indian psychiatrist, Kshitij, had made 3 papers on fast off effect. I had read just one. But in the second paper, he had actually given K values, which I didn't know. But from the airport to the city, the pharma company that had arranged this, they said another company had a seminar on the same topic by another speaker, and the local psychiatrist, they butchered him. So I was quite prepared and alert that people are going to be nasty with me. And this gentleman, who's a nice guy, I mean, I really like him, he got up and asked me a question. There was no internet, so you had to wait for the British Journal to come to you to read it. And I knew that he has something up his sleeve which the rest don't know. So I said, sir, let me tell you, the way you're asking me this question, you know that there is something that you know and I don't know. So instead of getting into a battle, why don't you please share your knowledge? He was thrilled. He took 10 minutes to tell what was something very useful. But when it came to giving the memento, The organizers gave me a memento. I walked over to that gentleman, gave him the memento. I said, "You deserve this." 25 years after that, he was my strongest friend wherever I went and we met. So we've got to convert an adverse situation into a friendly situation. And this happens when we put our ego aside. Now, this is a story that came to me spontaneously.
Yeah, I can understand.
Yeah.
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 Thank you very much, sir. We have already, like, say, the discussion went on, and we have already reached our time. So it's a bell time. So before we close, my heartfelt gratitude to our speaker, Dr. Vihang Vahia, for delivering such an engaging and insightful talk. Sir, today I came to know so many things which are not in the books. So that is something out of the books, and really that was not information, it was definitely a knowledge. And the another thing I must say, at the age of 75, your clarity of thoughts and the sharp mind is truly inspiring for all of us.
I wish my wife was to hear this, huh? Okay. Thank you very much. I want to reciprocate by saying that I'm indeed grateful to Himanshu Bhai to have introduced me to Dhiren Bhai, and for this wonderful uh, opportunity to address. I believe it's the orthopedic surgeons that we are addressing.
Yes,
And
yeah.
I would like to thank Mr. Maharshi Bhai of the OrthoTV.
Yeah,
For
sir, I'm doing that. I'm just coming to that point.
right,
I'm
sir.
coming to
Right,
that
sir.
point.
Thank you very much.
Yeah. So, dear audience, our sincere thanks to you all, because without you watching this program, we cannot continue this series. We truly value your feedback, and please share your thoughts about today's program on the WhatsApp number 97129256000. To serve you better, we have started a dedicated WhatsApp group, and in this group, we share information before and after each session. And basically, the theme or the aim of this is to discuss what is not taught in the medical school, but which is important for practice and life. So, if you would like to join this WhatsApp group, please scan this QR code and you can join the group. If you can't, just send me a request and I will add you to the group. So this is one thing, and my deep gratitude to entire Ortho TV team for live making this live streaming the good event. And you can watch this program on YouTube. Just search Ortho TV, Dr. Vihang Vahia, and what is not taught in medical school. And I'm sure that you will be able to find out that from YouTube. My special thanks to my great friend, Dr. Himanshu Bhai, for asking thought-provoking question, and definitely for connecting me to Dr. Vahia. So thank you, everyone, and I wish you a happy journey ahead. Thank you and goodbye.
Thank
Good
you.
night.
Thank you, sir.
Good night.